Good afternoon, and thank you for joining us for today's CMS-1500 webinar. My name is Sarah McDonald, and I'm from the Stakeholder Engagement Unit at the Workers' Compensation Board. To assist with your questions today, we have several board staff from our Medical Director's Office, the Data Management and Analysis Office, and the Office of Innovation. Today's focus will be on the new requirement for providers that you must choose an electronic submission partner to submit the CMS-1500 Universal Medical Billing Form electronically on your behalf starting August 1st, 2025. We want to encourage you not to wait until this summer to begin. Start connecting with submission partners now to see which one meets your needs. We will start with a brief overview of the CMS-1500 initiative, review the significant benefits of electronic submission, share the currently available submission partners, and take a look at the submission process. There will be time at the end for your questions. We ask you to please keep your phone lines muted, as we will be using the chat feature to receive your questions at the end of today's presentation. You may enter your questions throughout the presentation in the chat box located on the right side of your screen. We will answer as many of your questions as we can, but if you have questions that we don't get to today or think of something after the session ends, we will be providing you with resources at the end of the presentation. A recording of this webinar will also be available on our website and YouTube page in the days coming. So let's get started. Today's presentation will discuss a new component of the CMS-1500 initiative, which is mandatory submission to an electronic submission partner beginning August 1st, 2025. We will start with some background on the initiative and discuss the benefits of electronic submission and how well it's going. We will then review available submission partners, how to register for submission of your CMS-1500 forms, and review the process as well as some additional reminders you should be aware of. We will then spend the rest of the time answering any questions you may have. The board transitioned to universal form to reduce the administrative burden on participating providers who have previously had to use separate board-specific forms for the workers' comp patients. Electronic form submission provides an infrastructure to allow the submission of data to the board in an industry standard format. Since July 1st, 2022, healthcare providers have been required to use the CMS-1500 for all workers' comp medical billing. As part of the initiative, use of prior medical billing reports, including doctor's initial report, Form C-4, and doctor's progress report, Form C-4.2, have been discontinued. Providers must also prominently report the injured worker's temporary impairment percentage, work status, and the causal relationship of the injury at the top of the CMS-15 form medical narrative. Please note, provider types who are not permitted to opine on causal relationship or level of impairment are not required to submit this information. Beginning August 1st, 2025, electronic submission to an electronic submission partner will become mandatory. The board is thrilled with the success of the CMS-1500 form so far. Since July 1st, 2022, more than 16.7 million CMS-1500 forms have been submitted, including 5.5 million electronic submissions through an electronic submission partner. More than 14,800 providers have submitted their CMS-1500 forms electronically through an electronic submission partner. The board provided notification of a new requirement in August and November 2024, and again in January and March of this year. There are many benefits to providers, which we will go over shortly. The board will not act on or enforce payments of a paper CMS-1500 form submitted on or after August 1st, 2025. Forms that are submitted prior to August 1st, 2025 will continue to be processed, but providers are encouraged to transition to electronic submission well in advance of the mandatory date. Now we'll take a minute to highlight the many benefits of electronic submission. First is faster bill payment. Providers typically get paid quicker. Next, we have reduced administrative burden. The electronic submission partner submits the CMS-1500 to the insurer and the board. Providers will have confirmation within 7 days that their bill was accepted or rejected by the insurer. With date timestamp acknowledgement of receipt from the insurer, the provider is aware that they do not need to resubmit the bill. Technical errors are identified quickly, so they may be corrected and resubmitted instead of waiting for the insurer to deny the bill. And finally, there is no or low cost. Now we review the steps providers need to take to register for the electronic billing through an electronic submission partner. The medical portal provides access to online services the board offers, including registration for electronic submission of medical bills to insurers and the board. Once you have accepted the terms of electronic submission agreement, you can then discuss the details of submission with an approved electronic submission partner, also known as a clearinghouse. The electronic submission partner ensures that the medical bill and narrative attachment are sent and accepted by the correct payer and the board. After logging into the medical portal, providers who have not already signed up for electronic submission of the CMS-1500 will see a link for Agreement for Electronic Submission of CMS-1500 under the Billing section. Select the link and select the I accept button. The provider's name will be added to the listing of providers authorized to submit electronic data, which is updated daily. Once accepted, the link will no longer appear when you sign in again. There are currently 8 approved electronic submission partners. In order to ensure the integrity of electronic submission process, the board requires all prospective submission partners to engage in a rigorous testing effort. Approved electronic submission partners have executed a legal agreement with the board. You can find a published listing of all clearinghouses who are interested in testing or approved electronic submission partners for the CMS-1500 by visiting the providers page at wcb.ny.gov. Select electronic form submission under the billing tab of the resources section. Important to note, the board does not endorse any of the electronic submission partners who have shown interest in or who have been approved to provide these services. The board has no knowledge of any other aspects of the electronic submission partner's business. Thus, the board makes no representations or warranties, expressed or implied, as to any aspects of the electronic submission partner's business. After registering with the board, you may submit the bill and narrative attachment to the electronic submission partner by an agreed format, and they will electronically forward both to the workers' compensation insurer. Providers who wish to continue using paper bills will still have the ability to submit paper CMS-1500 forms to certain, but not all, electronic submission partners, who will then convert it and submit it electronically to the payer and the board on the provider's behalf. Providers who wish to submit a paper CMS-1500 form must ensure their submission partner they choose has this capability. There are submission partners who take paper and those who do not. The insurer will then accept the CMS-1500 form from the electronic submission partner and return electronic acknowledgement of receipt. The electronic submission partner will forward the acknowledgement, including the date it was received, to you. The electronic submission partner will also transmit billing data, CMS-1500 forms, and narrative attachments, and the insurer's acknowledgement of the receipt to the board. We ask you to please keep the following in mind. When the CMS-1500 form and narrative is submitted to an electronic submission partner, providers should not mail, fax, or email duplicate bill to the board. Providers who are required to permit to do so are strongly encouraged to use the narrative template to create the medical narrative report that must be submitted with the CMS-1500 for ease of locating the essential elements of causal relationship of the injury or illness to the patient's work activities, patient's work status, and temporary impairment percentage. For those using their own template, please remember to include these elements in a highly visible location on your report. Payments may be denied when billing is submitted improperly, for example, not submitted to an electronically through an approved electronic submission partner. This is very important. When a WCB case number is available, it must be populated in field 9A. Failure to do this may result in the CMS-1500 not being matched with the correct case, resulting in a delay of review and payment. Providers decide which electronic submission partner they want to use. Costs and services may vary by company. View the board's list of approved electronic submission partners. Providers will have the ability to offset the cost of using electronic submission partner by using code 99080. This was previously a no-charge NC code in the fee schedule listed as special reports such as insurance forms more than the information conveyed in the usual medical communication or standard reporting form, which may be used as a buy report BR code up to a maximum value of $1. The code should be placed on the same CMS-1500 form for which the billable services payment and the electronic submission costs are being requested. The price listed by the provider for code 99080 should accurately reflect the actual cost incurred by the provider for the electronic submission of the individual bill, up to a maximum of $1. Note, a provider who currently submits the CMS-1500 electronically via the electronic submission partner can bill to offset the cost. When billing for permanency evaluation, the doctor's report of MMI permanent impairment, Form C-4.3, must be attached to the CMS-1500 as the medical narrative. If you send a separate C-4.3 form to the board, it will be rejected. If there are more than 6 line items for one date of service, you may submit multiple CMS-1500 forms together with a total charge amount appearing only on the last form. Finally, be sure to enter the information correctly on the CMS-1500, including payer and employer detail as indicated on the requirements page of the board's website. We would like to share some other news of interest related to billing. On January 6th, the board issued new guidance to payers to reduce improper objections to medical bills. The new guidance also published on the board website includes when not to file Form C-8.1B, a list of reasons that cannot be used to file a form, and when Form C-8.1B is needed, a list of requirements for proper submission of the form. As a reminder, earlier this year, the board created a new medical billing dispute section of our website to assist providers and payers with the dispute process. The site details documentation and other requirements for common scenarios. You can visit the link on your screen for additional details. For more information on the CMS-1500 form, including a list of electronic submission partners and discontinued forms, please visit wcb.ny.gov/CMS-1500. We also have a dedicated mailbox to answer all questions on the CMS-1500 initiative. The email address is cms1500@wcb.ny.gov. As a reminder, if you're not already following the board on social media, we encourage you to do so. We are on X, Facebook, Instagram, YouTube, and LinkedIn, so link up with us. You can also subscribe to get board updates, the same ones our external stakeholders do, by hitting Get WCB notifications on the bottom of our website. Thank you for taking the time to learn about the CMS-1500 and all the benefits that submitting electronically offers. We would now like to take the rest of the time to answer your questions. But before we do that, we just want to take a moment, before we review the chat, we just want to take a moment to get some specific feedback while we have you here. If you're not already submitting the CMS-1500 through an electronic submission partner, we want to know what's holding you back. So if you could let us know in the chat, we would appreciate it. And once again, you may hear a brief silence as we take some time to review the questions that have come in the chat, and we will rejoin you again shortly.
Oh, hi, good morning. This is Audrey Cunningham from the Medical Director's Office. A couple questions here. The first is regarding the code 99080, what to do if payers do not properly reimburse. We have communicated to payers their responsibility to reimburse for this code for the offset, and they will in fact be subject to penalties from the board for failure to pay. The other question is with respect to paper bills. So as noted, as of August 1st, the board will not be accepting paper CMS-1500s, but I will point out there may be a few electronic submission partners who do take paper. So I would encourage you to work with your submission partners. And then again, it would be the electronic submission partner who'd be submitting electronically. But inquire of the submission partners. They may have on their sites whether or not they take paper. Thank you.
This is Dr. Tachi. There's a question that says, will electronic submission partners bill out to all insurers, or do we need to look up each insurer payer to see which ones that they bill to? The assumption is that most of the electronic submission partners are working with the majority of payers. There is a possibility that the submission partner that you are working with won't be submitting bills to all of the payers that you need them to. In those instances, the electronic submission partners are required to work through one of the other submission partners to submit the bill to the insurance carrier. So you do not have to seek out multiple electronic submission partners. That's part of the convenience of the system, is that you only have to identify one submission partner to work with, and then they will take care of the rest of the process for you.
Hi, this is Sarah here. I know we had some questions coming in where people were asking if they could get a copy of this presentation. We want to let you know that there already is a recording of this presentation on our website. So if that's something you wanted to review immediately, that is there. And we are hoping to get this recording up as well in the future.
There's a question, when do you use the 99080 code? So that code is in place for providers to have the cost of their electronic submission offset, at least in part. So the electronic submission partners may charge a fee for the processing of your bill. Those fees vary. We encourage folks to shop around for the electronic submission partner that meets their needs best. And whatever the fee is for that specific bill, you would include on that bill as one of your CPT code items, the 99080 code, for the amount that you're actually being charged for the submission. And for some providers, it may be 50 cents. For some partners, it may be more, but it's not to exceed $1.
Hi, this is Paula from the Medical Director's Office. We had a question about clarifying whether or not the insurer would respond to the bill within 7 days. They have to accept the bill within 7 days, but they have 45 days to actually respond.
There's another question about 99080, whether it should be added for each service date. The 99080 code gets submitted with each individual bill. I know there are some provider types, you see it a lot with physical therapy, that may put multiple service dates on one bill, which is not necessarily ideal, but the 99080 doesn't go per service date, it goes per bill submitted.
Hi, there's a question with respect to whether or not an HP1 is automatically sent from the board. So a bit of a separate topic from today's discussion, but the HP1 can be submitted via onboard by the provider 45 days after a bill is not paid or paid less than what you've requested. So payers are required to pay a healthcare provider's bill in full or submit a notice of objection within 45 days of submission of a bill, and then it's up to the provider to subsequently file an HP1 or request for assistance with a disputed bill. That's not an automatic filing.
Hi, there's a few questions in regards to what's required to be put on the CMS-1500 and which fields need to be filled out. Also, there's a few questions in regards to what's required to be entered on a medical narrative. We have a web page on our website that provides all details in regards to what's required on the CMS-1500 and the narratives, and according to which provider you'll be submitting bills for. It's
www.wcb.ny.gov/CMS-1500/requirements. There's a couple of questions related to payers supposedly not accepting electronic bills. As of the launch of the electronic CMS-1500 process, all payers are required to accept electronic CMS-1500 submissions if the provider submits them electronically through a clearinghouse. So providers are not required to do it until August 1st of this year. Again, you're encouraged to do so sooner than that, but all payers are currently required to do so. If you do encounter a payer that says they're not accepting electronic bills, you should not be required to submit the bill in paper, and you can let us know about that, and our payer compliance unit will investigate it.
I can take that.
But just a quick reminder here, if you haven't already put your response to the previous posted question about why you haven't signed on to using your electronic submission partner yet, please feel free to put that into the chat.
This is Dr. Tachi again. There's a question as to whether the C4.3 form has been replaced by the CMS-1500. The answer is as follows. When a provider does a permanency evaluation and has completed a C4.3 form in the past, but no longer, that C4.3 form was used for billing. Now, you are required to use the CMS-1500 form for billing for those services. So to bill for the permanency evaluation, you're required to use the CMS-1500 form. However, the narrative that you would submit with the CMS-1500 for that clinic visit is the C4.3 form. So it's not, for most clinic visits, it might be your clinic note. For the permanency evaluation, the C4.3 and whatever other clinic note attachments you might have with it become the attachment or the medical narrative for the CMS-1500 form. I will say that if you submit the C4.3 form by itself, however, you will not be reimbursed for that visit, and it will slow down the processing of that form.
Hi, there's a couple of questions with respect to hospitals and facilities that currently use the Form UB4. So those UB04 will not be replaced by the CMS-1500, whether paper or electronically. So continue to use your UB04 if you're a facility that does so. I will note that a medical narrative report is still required to be attached to the UB04 and should include the three elements, including patient's work status, causal relationship, and temporary impairment percentage.
There's another question that says, we are a small office and we are incapable of billing electronically. What should we do? So for those folks, whether it's because of the size of the office or whatever the circumstances might be, perhaps internet access, who knows, but for anybody who's unable or unwilling to submit their bills electronically, then as was pointed out in the presentation and one of the prior answers to the questions, there are currently 8 electronic submission partners, and multiple of those 8 partners, not all of them, but multiple of those electronic submission partners will accept paper bills from providers and convert them into electronic form and submit the electronic bill submission for you.
There's a question with respect to explanation of benefits and whether or not those are still required. In fact, yes, payers are required to submit EOBs and EORs electronically to their electronic submission partner, along with the CMS 1500.
Hi, there's a question in regards to checks and, would they be affected by this process? And the answer is no. The receipt of your checks would not be affected by this CMS 1500 process.
Hi, there's a question with respect to various clearinghouses or submission partners and whether CARISC is still a good resource. And in fact, yes, CARISC is on our list of approved submission partners. And I think it was mentioned before, but I'll underscore that we do have a list of approved submission partners on our website. And in that vein, there was a question with respect to if you are an electronic submission provider and you would like to become approved, contact the board and we can get you through the various testing that we'll have to do to get you approved. But certainly there is an opportunity to become approved.
I just wanted to bring everyone's attention to a question that was posed by our board staff to the group, and basically just asking if you're not currently using an electronic submission partner to submit your CMS 1500s electronically and you're still submitting them in paper format. If you could let us know why in the chat, that would be great. We would be very interested in knowing that.
There's a few questions asking how you can find a list of submission partners on the board website. If you visit the board's website, scroll towards the bottom, click on Online Services from the bottom footer on the website. And when you're on that page, under Submit Claim Forms, there's an option for CMS-1500 Initiative. That will then give you a menu option for the approved submission partners. That also has information regarding the dollar offset for the code that's been mentioned earlier, as well as additional information that you may find helpful for the CMS-1500.
Hi, we have a question. Does the billing service submit 1500 form, or the provider does? The billing services can submit the CMS 1500 electronically to the submission partner on behalf of the provider.
Hi, this is Paula from the Medical Director's Office. There's a question about a provider in Texas who has some patients with New York claims, asking if they have to follow these rules in order to submit for these patients. The answer is yes. You would have to file the CMS 1500 electronically as well.
There's a few questions about which submission partners will convert paper to electronic for those that don't have electronic billing at their practice. Earlier we mentioned how you can visit our website and see the listing of approved submission partners. Also on that same page is a column that lets you know which of those submission partners, and there's several of them, that will take your paper bill and convert it to electronic on your behalf, so you don't have to necessarily submit electronic to the billing partner. They would take care of that for you.
Hi, there was a few questions in regard to EOBs and EORs. If a bill is submitted through the new electronic submission process, the payer is required to submit the EOB or EOR back to the provider through your submission partner.
There's a question just for request for clarification about what happens if a submission partner is not contracted with a particular payer. So as was correctly pointed out by the questioner, most all of the submission partners have ability to submit to most all of the payers. There may be an instance that a submission partner does not have the ability to submit electronically to a payer. If that should happen, then that submission partner is required to route the bill through one of the other submission partners to the payer that needs to receive the bill. There are several comments about convenience and complexity of the electronic submission versus just mailing and faxing, et cetera. And I'll just say, from a provider standpoint, having been in the mailing, faxing world for a long time when it comes to the bills, one of the frustrations when you do that, though, when you're faxing your bill to someone or you're mailing your bill to someone, is the information that you have up to date? Is the fax number the correct fax number, or is the address the correct address? There's nothing more frustrating, perhaps, on the provider end to find out, weeks later that the bill that you thought was submitted actually went to the wrong fax number or went to the wrong mailing address, and then you have to scramble around to resubmit it to what you hope is the correct address. This takes all of that guesswork out of that process. You submit your bill to the electronic submission partner, and they make sure that it's electronically routed to the carrier for the bill.
There's a question asking if the approved clearinghouses are available now to submit electronically. Yes, they are. And I'll point back again to that submission partner list on the board website. There's also a column on there letting you know what date they were approved by the board. Most of those were approved back in 2020 and 2021, so they've been available for quite a while. But all are available currently, and you could start billing tomorrow electronically if you wish to do so.
Hi, there's a question from a provider indicating that he or she has completed the course mill requirements and is waiting to see if they have been accepted as a workers' comp provider. I encourage you to reach out to our provider administration unit. I'll put it in the chat. That's www.provider@wcb.gov. Again, we'll put it in the chat. But you can contact the medical director's office's provider authorization. Hi, there's a question with respect to no insurance matters. So in those matters, until liability is established, you do not need to submit bills electronically. However, once liability is established, you will be required to start billing electronically.
Once again, we're still looking for some of your feedback. If you just want to know if you are not already submitting CMS-1500 to an electronic submission partner, we want to know what is holding you back. So if you could put that in the chat, we would appreciate it. Thank you. All right, everyone, thank you for joining us today. In case you missed any responses, the Q&A will be included in the recording that will be available soon. Any questions that were not covered during the Q&A can be directed to CMS-1500@wcb.ny.gov, and someone will respond to your inquiry as soon as possible. Before we sign off, I would like to remind you to sign up to receive workers' compensation news, including information on future webinars, straight to your inbox. To sign up, visit wcb.ny.gov, scroll down to the bottom of the home page, and select Get WCB Notifications. We also distribute information via our social media channels, so please follow the board on Facebook, X, Instagram, and YouTube. Thank you again for joining us, and enjoy the rest of your afternoon.